Good afternoon. I'm Congresswoman Allyson Schwartz, President and CEO of Better Medicare Alliance, and I'm pleased to welcome you to our 2020 Medicare Advantage Summit. Thanks to leaders like you attending today's event, Better Medicare Alliance is now a nationwide coalition of 500,000 grassroots beneficiary advocates and nearly 150 ally organizations. So we represent stakeholders across the healthcare spectrum who share an understanding of the value of Medicare for today's seniors and a willingness to work together to advocate for the quality, affordability, integrated care available in Medicare Advantage. Now in its fourth year, our annual summit is the premier gathering for healthcare innovators and Medicare Advantage supporters. We're so glad you're here, virtually this year, but here at this summit. It will feel different, but over the next 3 days, we're going to hear from an all-star lineup of speakers who are leading the way in shaping the future of healthcare through Medicare Advantage. From the administration, we have HHS Secretary Alex Azar, Assistant Secretary for Aging Lance Armstrong, that would be good, Lance Robertson, and CMM Director Brad Smith. Members of Congress are Donna Shalala, Michael Burgess, Derek Kilmer, and Gus Bilirakis. We'll hear from speakers who are leaders on the front lines of patient management and care enhancements, many from our ally organizations, plans, providers, aging service organizations, and community partners. Key players will discuss issues that are top of mind, from racial disparities in healthcare and the drive to health equity, to innovations that drive value and telehealth, to the importance of social determinants of health in the health and well-being of Medicare beneficiaries. We may even talk a little politics and its impact on Medicare Advantage. We don't want you to miss a moment of this week's events, so stay close to that computer. Be sure to follow along on each day's agenda, and don't forget to join the conversation on Twitter using the hashtag MASummit2020. I'll be with you along the way, and we'll be available to answer your questions tomorrow morning at 10:15. So tweet your questions to us or share them using the chat function on your screen. Of course, this summit could not be possible without our generous support of our sponsors. I'll be mentioning them along the way, including today's gold level sponsor, Livongo. Thank you for your support. And thank you to my staff, led by Robin Garaki. She's Chief of Staff, and I want to thank you for her incredible work ethic, positive nature, and the ability to bring it all together. But before we begin, I want to acknowledge the context in which this year's summit takes place. COVID-19. The pandemic has changed our lives, placing new demands and limitations on each of us and our entire healthcare system in ways we could never have imagined. The COVID-19 pandemic has already resulted in nearly 8 million cases in our country and claimed 215,000 American lives, with an oversized impact on the elderly, the poor, and on minorities. This pandemic has brought pain and suffering with long-lasting health and economic hardship for so many. Yet we have seen individuals and communities and organizations rise to meet the challenges. I'm proud of the Medicare Advantage community, plans and providers, community-based organizations that have more than stepped up to be leaders in meeting the needs of seniors and disabled beneficiaries without hesitation and with the innovative know-how and can-do spirit that many of you bring to your work every day. At BMA, we reach out to hear your stories, and then to share those stories of what you did and what you continue to do to get care for the sick and to meet needs beyond medical care for beneficiaries. We took note of your challenges, and we worked to get the right responses from Congress and the administration to waive regulations or change statute to better enable you to do the work that you need to do, and they were responsive. Your experience and creativity and determination show the value of Medicare Advantage for millions of beneficiaries during this crisis. Your efforts ensured continuity of care, reduced stress for your patients and clients, and likely saved lives. All of our ally organizations have been directly involved in the response to the COVID pandemic. We're grateful for your efforts, and we look forward to hearing more over the next few days about your work and how it may impact healthcare in the future. And I am proud as well of my team at BMA. Together, our work has made a difference. But our work is not done on COVID-19 or in telling the story of Medicare Advantage. Policymakers need to know how Medicare Advantage is leading the way in telehealth, in Our providers depended on payments from plans when fee-for-service payments essentially disappeared. When plans lifted co-payments and guaranteed coverage for testing and treatment, when meals and medications were delivered, when care managers and primary care teams made calls to at-risk patients to be sure they knew they could depend on their healthcare to be there for them, and when home visits continued even early on when less was known about the virus and PPE was scarce. These actions were appreciated and they gave hope at a difficult and uncertain time. In the midst of the COVID-19, we dared to poll seniors about their care in early May 2020. We wanted to know beneficiaries' concerns, and we thought we'd hear lots of complaints. Instead, we found 99% of beneficiaries were satisfied with their care. They expressed satisfaction with their health plans and with their practitioners. Well-deserved praise. Going into 2021, there's a lot of good news for the 25 million beneficiaries in Medicare Advantage. Premiums are down to an average of $21 a month. There are more plan choices, including in rural areas, and there are more supplemental benefits. Enrollment numbers are expected to continue to rise, with 42% of Medicare beneficiaries expected to choose MA during open enrollment, which begins tomorrow. For all these reasons and more, we surely can say Medicare Advantage is building the future of Medicare. None of these successes happened by accident. And over the next 3 days, we'll hear from a host of engaging experts on how Medicare Advantage delivers higher quality and better outcomes at lower cost for so many seniors. I'm looking forward to sharing more with you about our work at BMA and the latest insights on Medicare Advantage during my remarks each day, including new research on Medicare Advantage beneficiary demographics and enrollment trends and opportunities to improve the enrollment process. If you're interested in joining us to advocate for seniors in Medicare Advantage, I invite you to visit our website at bettermedicarealliance.org, sign up for informative policy alerts, and consider becoming a BMA ally organization if you're not already. Our team is available to answer your questions and that you might have during the MA Summit or in the weeks ahead. So now, please help us kick off our summit by welcoming our first speaker, Michael Sturmer, who's a Senior Vice President of Health Services segment for Livongo, our first keynote address. Livongo provides incredible health management tools to help beneficiaries with chronic conditions stay on a path to wellness. And they are a generous gold-level sponsor for this year's summit. So thank you, Livongo, and take it away, Michael.